Basically, I'm here to tell you about Beacon, about our organisation, and to share that stage with our two co-founders, Nick and Tony, who are going to take you through some of the journey that's led us to this point. For those of you who hadn't managed to listen carefully to what Phil's saying already or paid attention to all the social media, there is a big news story in town today. That is that Find a Cure, the organisation I've been with since 2015, has made a decision to change name and become Beacon for Rare Diseases. This is something we've been working on for over a year now, and it's great to finally have it official and out live in the world. The questions that are going to pose for you guys in the audience are probably two. One is why, and the other is what is Beacon. I'm going to try and really answer the first question by answering the second consistently for the next 5-10 minutes or so. The simple answer to what is Beacon, for those of you that know Find a Cure and our history, is really straightforward. It's a new name for the same team, the same set of projects, and the same broad drive, but hopefully a name that helps to more clearly encompass and clarify our mission, our purpose to you guys and the community out there in the rare disease world. That simple answer, though, is kind of dull and not engaging to the rest of our audience here that are new. So I'm going to never give the easy answer and dive into things in a bit more detail right now. Simply, Beacon is a charity, and that's worth stating. We're a charity based in the UK, and we're here to help the world of rare diseases in whatever way we can. But again, that's not the most engaging. When I think about what Beacon is, what I think it comes down to me is Beacon is about people. Beacon is about the people who make up the team, who we've already introduced you to you today. There are 8 of us now, which is a heady number, but it's more than just that core team that do the work day to day. It's also the community of advisors we have supporting us, our board of trustees who help us think through the strategic moves we're going to make as an organisation. And crucially, our advisory committees, like our patient group engagement committee, you can see here, who really give us key insights into what's happening and what's important in the rare disease world for patient groups in particular. But again, that's really not encapsulating it enough. Beacon is actually, hopefully, a community, a rare disease community of a whole range of different people, different backgrounds, who are focused on trying to make a difference for rare diseases, or at least interested in rare diseases. So Beacon is in many ways you guys out there in the audience, and that's what we're trying to aspire to. And hopefully everyone as part of that audience, that community, is united by a really simple purpose, a purpose that we don't want anybody living with a rare condition to face that journey alone. There should be no rare journey alone. We no longer want to see this age-old story of someone waiting years for a diagnosis and receiving it as a printout from Google and being told, we don't really know anything more than this. This is what we've got, go home and cope with it. That is isolating, that is lonesome, and that's not something that we should be seeing today. We no longer want to see the isolating experience of people living with rare diseases, where they just never see a chance, never see a hope of any kind of treatment that can modify their disease in some way, or even just manage their symptoms. We no longer want to see situations where people with rare conditions, just through a quirk of genetics or fate, whatever you want to call it, struggle to hold down paid employment, or struggling to access the support that society should give them, or education. These are isolating things that are unfair and make that rare experience lonely, and something we're trying to stop as an organisation. What we know, though, crucially in the work we're doing, is that patient groups are the vehicle that's going to drive this change, and has been driving this change for years. Patient groups are the people that are connected and connect other people with patients together, so they support each other. They are the first place many patients go to actually meet someone else with their rare condition. Patient groups provide the driving force to get research moving. They can instigate it and they can keep it moving so that it stays on focus, on target to deliver treatments to those people that need them. And they can really advocate in a meaningful way for change for their rare condition. And that's fundamental because they understand what the condition is. They understand what it means to live with their rare condition day in, day out. And that's something that no one else can ever really bring in the rare disease space. And it's because of this that they provide that impetus for change. But the reality for many of these patient groups that we've seen over the last 9 years or so in operation is that the majority are run by volunteers. They're run in the spare time, in between a full-time job, in between full-time caring, in between full-time just living day to day with whatever symptoms patients might be experiencing. As such, they tend to have little resources, whether that's time or money. And often when these groups start, they lack fundamental knowledge of the charity sector or the life sciences sector. But regardless of all this, they actually do an amazing job consistently. They find ways to instigate new care pathways, to start rare disease registries, to simply bring patients together, to run conferences, to move the needle forward in their rare disease sector. What we want to do as Beacon is be here to help those patient groups. We want to be here to help you be you, to do whatever it is you need to do as an organisation. To do that, we've got 3 major strands of work. And the one that most of you will be familiar with and see day in, day out is our patient group training. And this is all about finding ways to help patient groups to form, to grow, and to move towards professionalisation, to help them do the things that patient group needs to do, whether it's raising awareness or getting research ready, whether it's forming as a charity. And we deliver this training in a whole range of different ways. That might be live or on demand. It might be in person or online. It might be a single session you ever attend, or a year-long guided program where you engage with people across that whole period. Our focus is trying to find ways to provide useful information to you guys in a way that helps you do your job. Alongside this, we try and work in the rare research field, finding ways to collaborate in projects where possible to push things forward, advocating for drug repurposing wherever possible, but primarily trying to support and promote a patient-centered approach to research, to showcase excellence that's happening in that rare research and help people learn from what's going on out there. And finally, and probably most importantly around our new name, our new identity, is this idea of community. We really want to focus on building a united, diverse, rare disease community that has patient groups at its heart. What this is all about is finding ways to connect people who wouldn't otherwise be connected and to build a more powerful force behind rare diseases as a collective. And every project that we're doing, whether it is running a webinar or talking about a rare disease podcast, whether it's a rare disease conference on drug repurposing or an essay competition, at its heart, we're trying to find ways to connect people, whether patient groups, students or industry, together to share their knowledge about rare diseases and learn from each other. And that is fundamentally the reason why we have chosen the name Beacon. A beacon should hopefully light the way for those patient groups, provide them a guiding light, guide them on the journey that they're trying to take to wherever they want to be. It should hopefully work to draw people together around a common purpose. And that is the reason we've made this change. We're really excited about it, and we hope it gives a strong message to everyone out there about why you should engage with us and how we can help you. But what's important now, obviously, is not just what we're going to do next, but how we got here. What is our history and what is the journey we've been on? And at this stage, I'd love to hand over to my 2 co-founders, two founders of the charity, Nick and Tony. So tell us a bit more about our history. So Nick, please, over to you.
Great. Thank you very much, Rick, for that introduction. So I'm Nick. I am the chair and the co-founder of Beacon, formerly Find a Cure, along with Tony. And the journey really started for me 21 years ago when my first son was diagnosed with the ultra-rare disease, alkaptonuria, AKU, also known as black bone disease. Then my second son was diagnosed 3 years later, and we knew of no treatment. There was no patient group. There was really nothing much happening anywhere in the world for this ultra-rare genetic disease, which would become severely debilitating as life progressed. And when we joined forces with a patient and a doctor to set up the AKU Society 19 years ago, we had to learn everything from scratch: how to fundraise, how to work with academia, how to work with clinicians, how to identify patients, because we only knew of 4 at the time in the whole world, and 2 of them were my kids. How to work with industry, all that kind of stuff we had to learn from scratch. And fortunately, it went well, but it took a long time. Okay. And in 2010, 2011, things started to pick up when we had a big grant from the European Commission to develop a drug called nitisinone. And that was a steep learning curve. And that's when Tony came in. Tony, who I met at a World Orphan Drug Congress in November 2010. When I told him my story, he said, I really want to help. And we became very good friends. And 2 years later, when I started thinking about setting up Find a Cure, I joined forces with Tony, who was at the time mulling over an idea of setting up a not-for-profit drug development organization that he will talk about in a minute. And that was really the birth of Find a Cure. I was being called up nearly every week by patients, by parents of patients with ultra-rare diseases for which there was no patient group. And they were saying, what do we do? How do we do it? And rather than give them piecemeal organization, Tony and I thought it would be better to actually set up piecemeal information, Tony and I thought it'd be better to set up an organization that would do this consistently. And that's why in 2012, Find a Cure was born, okay? And over the past 10 years, we have been doing, trainings and peer mentoring and all kinds of things to try and build what we call these kitchen table groups. And these are often parents whose child has just been diagnosed. One of the parents will probably be looking after the child, so will have given up work. The other one will be working overtime to try and make ends meet. And at 11 in the evening, when the child's gone to bed and they've eaten and everything, they'll be like, let's work on this patient group and how do we make it work? And rather than reinvent the wheel each time, what Beacon does is teach them and help them and provide them with guidance on how to work with industry, how to do clinical trials, how to fundraise, what's the whole regulatory pathway and all that kind of stuff, basically. So this is really important. And so we're now entering a new phase for Beacon, and that's why we've changed the name. But before going into that, I will hand over to Tony, who will explain also about his vision, his thoughts behind the whole Find a Cure Beacon adventure. Tony, over to you.
Thanks, Nick. So hello, everybody. Fantastic that you could join today. So I thought it would be hopefully interesting just for me to say just a little bit about how I got involved with Find a Cure right at the very start. And so this was really following on from the Develop a Cure projects that Nick mentioned, where we raised money from the European Commission to repurpose the drug nitazoxanide for alkaptonuria. And Nick was already working on his ideas for Find a Cure as a really sort of patient support charity. And I thought, well, could we really take things a step further and do actual drug repurposing through Find a Cure? Could we repeat this idea that we'd done with the Develop a Cure project and find more drugs that we could repurpose and raise money and then take them through, right the way through development and get a marketing authorization at the end of it. I guess we were a little bit sort of heady from the success of the Develop a Cure that we'd managed to raise money from that. But we set up Find a Cure Development at that time as a kind of subdivision of Find a Cure and set about seeing how we could make this approach viable on a bigger scale. And I guess we had two sort of main challenges really at that point. The first was to identify viable drug repurposing candidates. Obviously, that's a prerequisite for starting any drug redevelopment program, drug repurposing program. And then the second was to try to identify ways that we could raise enough money to fund the development. And we actually thought that the first bit would be quite easy. We thought there would be loads of such drug repurposing candidates out there, but it was actually surprisingly difficult to identify suitable candidates that didn't require a huge amount of work just to get to the point where we could actually get into the clinic and start some clinical trials. So that already made it quite difficult to get started, because obviously if you have to fund a lot of preclinical work or something already before you can go into the clinic, then that really puts you back several years, and you already need to raise a lot of money in order to do that. So I guess that was the first sort of big challenge. The second challenge, of course, came perhaps as expected in how do we raise money to fund this kind of development. And so, of course, there are these big EU grants, there are a few other big grants around, but the lead time for these is rather long. And in the meantime, you still need to cover a lot of costs. And so that makes it quite difficult to fund development in that way. I mean, again, we were really lucky with Develop a Cure because it just all fell into the place with the charity that Nick was running at the time. And so we started looking at other mechanisms as well, social impact bonds, and there is actually some information about social impact bonds on our website. But again, after exploring that for a while, we decided that wasn't really the best way forward. So we have, however, had one or two successes along the way. So we are currently involved in a Horizon 2020 project, which is a project to repurpose the drug carbamazepine for a rare bone disease called MCDS. And we've also something that Rick will talk about a little bit later, we've also been successful very recently with another EU-sponsored program to develop a drug repurposing platform. So we decided at that stage that perhaps the whole trying to fund drug repurposing was perhaps a bit overambitious, and decided to focus more on the patient support side. And of course, a key element of Find a Cure has always been really to put patients and the patient voice at the heart of research. And so we came up with this idea to publish the book. So hopefully some of you would have read that, the Patient Group Handbook. It's called A Patient Group Handbook, a practical guide for research and development. And you can find it on Amazon. I think the Kindle version is free. If you want a printed version, there's a small cost to cover the printing costs, but the Kindle version, I think, is still free. And the idea behind this was to have, I think we have 25 chapters in there, and we wanted to try to cover all the elements that a small patient group would need to be able to get off and start driving research. So very much aligned with the whole philosophy of Find a Cure, very much aligned with the workshops that we've been running over the years and which are very successful, and with the materials that are also on our website. Now, there's a lot of materials on that website now. So I think for drug repurposing, we've been quite successful, thanks to Rick and the Find a Cure team. And so we've really been, I think, quite successful in helping to push forward this agenda for repurposing and bring it up as a high profile and worthwhile thing to do. And we'll certainly continue to do that in the future as Beacon. So I hand back to Rick now. Thank you very much.
Thank you so much, Tony. Nick, did you want to say anything else on the future side of Beacon?
Yeah, absolutely. So, I mean, it's a really good time at the moment for Beacon. You know, the whole rebrand is about giving kind of new impetus, and also the name itself conjures ideas of kind of lighting the way and hope and all those kinds of things, which is why we decided on this particular name. But I think the two areas that we work on are the kind of patient group support that is growing and will continue to grow. I think a lot of it also is working with other groups such as Eurordis or Genetic Alliance, you know, and different groups in the UK, Europe, around the world, and really building this rare disease social movement that has been happening over the past decade or two, and which is growing now. Which I think, you know, was more difficult during the whole pandemic and the lockdowns, but I think now we're starting to pick up again, you know, and Beacon is really going to be at the center of that, working with the others, driving it forwards and trying to help more and more patients set up their groups and build their capacity and grow and really advocate for their needs and what they want to do. And then on the drug repurposing, as Tony just said, you know, there are going to be some big announcements from Beacon on this, some very exciting work. You know, drug repurposing is a place that is full of hope, but also full of challenges, you know, due to the nature of these drugs, which are often generic, etc. So what we're going to see there is a big move forward, you know, so we're really excited. We think the timing of the name change is absolutely perfect. And this would not have been possible, obviously, without the whole team at Beacon who did all this work, but also our trustee, Andy Milligan, who's one of the world's leading branding experts, who has helped us so much through this. And of course, through Costello, Sophie Costello, and her team at Costello Medical, who have really helped through all this. So a big thanks to all of them. Rick, back to you.
Thanks so much, Nick. And yeah, I just think it's really worth thanking all the team for the work they've done to get us through this rebrand, and particularly the team at Costello and Andy to help us putting this all together. I'm just going to wrap up now with a couple of points. I think in changing the name, you know, we really want to use this as a way to focus on the success we've had and what we're going to build on. And I'm really proud of some of the work we've been able to do in the last 9 years or so as Find a Cure in the time I've been here. We've delivered over 30 different training workshops for patient groups in that time, which is a really big number and a huge breadth of training delivered. Over 80 different mentoring relationships have been established during our mentoring program, and many more to come. In our last empowerment year, which ran from 2020 to 2021, we supported over 160 different patient groups, and we're seeing that number grow from outside the UK too, which is brilliant to aid that collaboration between patient communities across the world. This event in our 2020 virtual Rare Disease Showcase, we saw over 315 attendees attend live, and as we've already heard, over 550 registered for the event today. Is really exciting to help build and nucleate that community that we're trying to push forward at Beacon, and huge amount of that done with a really small staff team who are hugely committed to the work we're doing. What that means for the future then, who knows, but we've got a few ideas and plans. As Nick said, we're really keen to drive forward and work more in partnership with other umbrella organisations and rare disease groups in the UK and beyond to try and make sure we've got a really coherent message between us and utilise the resources we have at our disposal to be better for the patient community. We want to support more patient groups, more individuals with more tailored training, more specific, bespoke solutions to the problems that you're facing. We want to really help connect our really strong UK patient group base with the wider world and vice versa to make sure we're seeing international patient group collaborations. And we're really aware that it's hard for these patient groups to take that step into professionalisation, to find that first person on a payroll, that transition can really drive those groups forward. So hopefully in the next few years, we can find a way to help provide more resources to groups so they can do that. It's a real challenge we're keen to push on. And as Nick and Tony have mentioned, we literally heard yesterday that an EU grant that we're a collaborator on has been funded successfully. So we'll be doing hopefully a lot more work on repurposing through a new collaborative project called Ready for All. If you'd like to hear more about that, then please check out the breakout session sometime tomorrow led by Anton Usi from the Artris, who can give you more insights into repurposing on a European level. It's really exciting times. So thank you, Nick and Tony, for giving your view on the history of our organisation and the direction. Thank you all for listening, and I'll be really happy to take any brief questions before we move on to the rest of our excellent speakers today. Thank you very much.